Hospital development has been a 10-year journey, one that started where our board of directors at the time really put hospital development on the forefront. It was part of a strategic plan, I think back in 2014, that really kick-started a lot of the work. As you've been to our hospital, you'll understand immediately why we need a new one. The earliest parts were from the 1950s. We've seen some expansions over the 1960s and into the mid-90s. But our current building is small, it's antiquated. And so when you have a building as that starting point that just does not meet those current standards, the current contemporary standards for healthcare, and you layer that with a fast growing population that we serve here in South Georgian Bay, it really becomes a challenge for our patients, for their families, for our staff as well, and all of our team members trying to deliver on our vision of outstanding care for life. Some of that early work are really just initial submissions. So we had a pre-capital submission was the first, followed by our functional programming and functional planning and master plan, master program. And that was iterated over a number of years. But again, a lot of that is what is known as the early planning stage. And a planning stage where those submissions, as I said earlier, are few and far between. So coming out of early planning and knowing that we were just recently approved for detailed planning, it became very apparent very quickly that this was now work we could not do off the side of our desk. We needed to have someone come in who has led a project of this size and scope, and a team that has basically done this before.
The purpose of a hospital development team is really to represent Collingwood General and Marine. We know that within the four walls today, there are physicians, there are frontline staff, nurses, therapists, volunteers, so many people whose voices need to be heard. They are the ones that are going to work in the new building. We are the bridge between architects and the planning consultants and eventually the builders to get those voices heard. So we have to bring the messaging forward, we have to sit down together, we have to design it collaboratively, and we have to then push for what this community needs and what the staff need in order to care for the community.
And I think we lucked out in many ways. I think with Kathy, there was no question. It wasn't just about what she brought to the table. It was also that she was going to be all in on this project and embed herself in the community. And this would be a project that she wanted to start and finish. And to me, that was something that was just the sort of the cherry on the top.
This is the dream team.
It's literally the best team I've ever worked on.
Everybody brings a different strength to the table.
We're putting it on our sneakers or putting it on our moccasins. We are quite a diverse team. We bring so many gifts.
I am on my toes in such a good way.
I had expertise that I needed, but I was really hoping to achieve that in individuals who were willing to grow and be open to not just checking one box.
The team all brings their own expertise and talents, and they're strong, mostly women, and I find them all really inspiring.
We all come from shared experiences. Our paths have crossed before, so it was really all of us coming together in a safe place where we can be friends and build a hospital.
Everyone is so collaborative. Everyone brings such an interesting perspective given their subject matter expertise, and coming together is such a quality experience.
It's nice being able to pick their brains, especially on the clinical side of things. It's, you get to know more and more about hospitals, not just the operational side of it, but learning more on the clinical side.
Being part of the project from this stage, it's very rewarding to watch it come to life.
I wonder what's around the next corner, and I wonder what the next challenge will be. I've never worked on a hospital development project, so I'm learning as I go and learning from such amazing people with such fantastic experience.
First milestone was the kickoff for our planning, design, and compliance team, or our architects.
They're the consultants that will lead us right through this phase up into our ministry submissions.
The work that has to be done in the years leading up to procurement and shovels in the ground is all about designing the space and creating the documents that we put out to tender. So the way I like to describe it is we have to write the story and we have to draw the pictures that prove that the story works.
Getting the first steps in place is sort of how it looks, because we were at the table playing with a bunch of blocks like little kids, but it was kind of fun. So you could put the pieces where they fit, and then you got to sort of see a footprint of what it's going to look like. So that was kind of intriguing.
We knew we needed to be able to visualize the space that the building would be sitting on. As part of our design work with the architecture firm, obviously they need to know the shape of the land, they need to know the attributes of the land.
Doing diligence, understanding what's in the land and what more we can learn about the land.
So that means drilling deep to understand if there are any risks to what's going on there, the history of the land. Would we find anything archaeological that we needed to respect before we started the work?
Starting our first round of stage 2.1 illustrative schematic design, functional output specification, user group meetings.
And the user groups are the folks that are working at the hospital today, the leaders and the frontline staff, the volunteers, the physicians. We all sit down together and we block out which departments go where, how the main floor will look, how many stories the building will be, all the relationships between it, what are the travel paths.
I'm a firm believer that we can sit out here and we can look at the bigger picture and say, well, it should look like that. But if we're not asking the right people that are actually living it, breathing it, and being in relationship with it every day, then we're misstepping.
And it was a lot of work. It was a lot of prep, 3 weeks straight of meetings all day to get through all of the planning and rules that we need to write in order to be able to present documents to the ministry and to go to market.
The purpose of visioning sessions, especially in the community, is to hear the voice, hear the unique perspectives of why a hospital in Collingwood might look different than one that is perhaps downtown Toronto.
That is where we get all of the most important and vital information is from these events.
It's really important to interact with the community and make sure that they feel heard.
The genuine interest that the community has in making sure that this is a supportive place for all.
It was good to hear what was important to them. You know, things like natural light and welcoming environments, but also good patient care.
And so what we learned was, as we invited community members to look at images of hospitals that have been built across Canada and place stickers on those that resonated with them, we learned that Collingwood really wants to embrace the outdoors. They want light. Biophilia is the term, but it's about bringing the outdoors in.
So people are starting to get, excited for it, knowing that there's going to be a brand new hospital coming. So having those visiting sessions, that's a key piece of the whole development, is getting the community involvement so they can sort of get a feel and a taste for what's coming.
I do live within the community, so I saw a lot of our neighbors and friends at these events. Their feedback was really important and they know that they are being heard.
You could really see how much thought was going into the answers that were being given back from the community.
I was very impressed with the general community knowledge around what we need to build a successful hospital that meets everyone's needs.
So really looking forward to incorporating their feedback into the process.
When I first came to Collingwood and was introduced to Heather McIntyre, and she let us know the history of the land, she alluded to all of the various groups, not just one, that might be interested in the work that we were doing.
Everything in our life is a spirit. So we're often asking permission and giving thanks in every move that we do.
It was very evident that walking the land with an elder to hear the voice of where we intended to build the hospital was important to those communities to know that we were doing this the right way.
We just walked as a team and we talked about the stories and the imprints that that land was telling us. Who was there before? Who were the peoples that walked that land before? What villages were around here? What this area was used for? What the plants were that were on that site? Asking the questions of what direction would the hospital be put in? What uses? What did they want to put in as the intention to really greet that soil and that land and those trees, and talk to all of those elements around that space to say, thank you for what you've given us. We're preparing to create a space where a lot of healing is going to happen.
Heather's taught us that on the land there are medicines that are growing there now, and she wanted to make sure that in the future we had a plan for how we could harvest those medicines and support Indigenous populations in healing, both in Western tradition but also in their own way.
Walking the land where the new hospital is going to be with our Indigenous partners was a highlight of not just this project, but of my career.
I did have the opportunity to be a part of the land walk, and it was a very moving experience.
They may have an understanding for that land that we don't know and appreciate. And so that land walk, we learned that the 4 directions are very important to Indigenous people, which way their feet are facing when they come into this world and when they exit this world had an influence on where we'll place this building and what ways the windows will face. And so knowing that now was absolutely essential.
I'm looking forward to the end product. I'm looking forward to the next years of developing what will be the best community hospital in this country.
I'd love to watch the groundbreaking.
The first shovel in the ground. I think a lot of people in town would agree with that, and a lot of people on the team would agree with that. It's just such a tangible representation of everything that is happening at the hospital and all of our collective excitement about the next step.
I think that is going to be a giant milestone, because then that's sort of a solid feather in our cap that, hey, the ground is now broken. We mean business, we're moving forward.
I'm really looking forward to collaboratively and intentionally putting Indigenous space in the Collingwood General and Marine Hospital.
I'm really looking forward to diving a little bit deeper with the users and the community, writing the specifications and meeting the scheduled deadlines and submissions to the ministry with the hopes of going to market in 2027.
Honestly, I'm just really looking forward to seeing a project from start to finish. I know it's a long time. Coming from an architectural background, you tend to get pulled in different directions. You start on one project and then you do a little part of it and then you move on to the next project, and you don't necessarily see it all the way to the end. So it's really exciting for me to start at this very early stage and then make it all the way to opening days.
And I have no doubt that we will do that because of the phenomenal team that we have and the phenomenal community engagement and hospital engagement.
We're going to start the new year up and running very quickly because we have a series of 4 submissions that we make to the ministry, and it's wrapping up the story and the pictures of what has to go to market. So this is the stage 2.1 work, and it will be a round of user group meetings. It will be getting these documents put together, approved by the board, and submitting them in March, April, and hopefully wrapping up by September. And so it's a lot of work, but a lot of fun and exciting work leading up to bringing on a constructor and getting shovels in the ground.
I think what excites me the most about the future of CGMH is we will finally have a building that truly reflects the high quality care that we provide today.
Bringing a building forward for the community and for the clinicians that really starts to embrace more technology. It brings a new standard, so private rooms, private bathrooms, really puts us in a great position for the future of healthcare and for providing services to the community that they so badly need.
That future patient who comes in for care and receives it in a modern and state-of-the-art setting, for that family member to visit them and to have a safe and private space in which they can see their loved one recover, and for our teams just having the space and the ability to work in an environment that's very open and inviting and promotes wellness. I think it's really going to complement the great care that our teams are providing today.
The hospital development team here at CGMH is excited to move forward. We bring a wealth of experience and commitment to this project that is essential, and I think the message is we've got this, and we're really excited to bring it forward and bring it to you in the future.
Our teams are dedicated and are committed to building the best possible hospital for South Georgian Bay, not only for now, but for decades to come.